Early diagnosis means greater chance of survival, so improving the ability to detect hard-to-read cancers like pancreatic will ultimately save lives.
At the moment in the UK, we see just under 60% of cases diagnosed at stage 1 or stage 2, looking at all tumour sites. We're still seeing kind of quite a variety in the routes to diagnosis. And then when we look at specifically pancreatic cancer, we're seeing a really high proportion that are diagnosed at a late stage, and that's where treatment options are really reduced, outcomes are really bad, survival is really poor. We know in the UK we're seeing around 80% or so of those cases diagnosed at a late stage. In Gibraltar specifically, it's similar numbers.
It's a very vague symptoms. It can be related to other day-to-day conditions, and that's one of our campaign messages is always to think pancreatic cancer sooner.
A little bit of nausea, fatigue is quite common. Maybe if their stools change, so their poos change in terms of if it starts to float or look oily, that can be a really early sign of pancreatic cancer, because it means the pancreas isn't working as efficiently and isn't metabolizing the fats in the stool properly. You know, maybe when patients come in with changes in bowel habit, for example, would always go down a different pathway, sometimes around the gut, but sometimes, you know, patients with changes in their bowels can also have pancreatic cancer as well.
The training has also covered some of the red flags with other cancers.
Again, they're quite similar. So again, I think a cough that doesn't go away, any blood in your wee or in your poo, any kind of fatigue that's relatively new in onset but is quite profound. Again, in terms of nausea or kind of a change in the bowel habit, those would be the things that would prompt to go in, and maybe a little bit of abdominal pain or some back pain sometimes. If you're getting sweaty at night, for example, that can be another thing. Or if you kind of lose your appetite, that again can be another thing. And certainly if you notice that you're losing any weight, that's really a big red flag that I would say you need to report.
They've given us a lot of tools regarding how some patients can present, making us think, or could this be a cancer, or could it be something else? Also about family history as well, which a lot of us weren't aware of. This serves to bring these more challenging cancers that can be diagnosed to the forefront, so that it's there, so that if a patient does come in, it makes us think about it.
Any healthcare system, be it the NHS, US, or even in the GHA, how we deal with cancer and the cancer outcomes are a fundamental metric when we measure performance of the healthcare system. So educational sessions like this are fundamental to improve and facilitate our cancer care within Gibraltar.
Training sharpens doctors' instincts, but the very first step comes from you taking charge of your health. If something is amiss, make sure to see your GP.